Internist Dr. Terence Drew is calling on the government of St. Kitts and Nevis to get help from Cuba to set up a strong medical system to deal with the coronavirus or COVID-19. With St. Kitts and Nevis designated a high-risk country for the importation of the disease, Dr. Drew urges a robust national response to the coronavirus pandemic using the expertise of the medical community of Cuba because of their experience with dangerous infectious diseases. Dr. Drew also is a candidate of the St. Kitts and Nevis Labour Party and spoke in response to questions from the media regarding COVID-19 at a recent press conference. Regarding preparations that should be made, Dr. Drew made the case for urgent additional support.
We don't have an infectious disease specialist who is a specialist who deals with infections. We don't have a lung specialist or pulmonologist who would deal with most of the severe complications as a result. And we don't have an ICU specialist, so to speak. And therefore, I had asked the government, and Jamaica is now doing it. Jamaica has requested from Cuba about 50 to 100 nurses, I think, because they know that their infrastructure is not such that they can deal with it alone. I know from the beginning that the only country that I suspect who can really deal with this, if this were to hit the Caribbean as it's hitting Europe, is Cuba, because it has a specific type of infrastructure and its experience from the Ebola. And I've been asking this government to call the Cubans in, bring in a number of specialists, and ask them to help us to set up the infrastructure and a plan to deal specifically with it, even to deal with those who would become severely ill. One case can shut down the country to a great extent, or parts of it, and therefore, I am saying that the government needs to bring everybody together. We need to have a more strategic, more succinct health plan and ask for help. Ask for help because we know the infrastructure that we have here in health cannot sustain this. I'm going to say it again. The government needs to ask for help now. We cannot be over-prepared. If we don't get a case, which is least likely, and we would have been prepared, good. We're in good standing, and the experience would help us for the next one, because the next one will come. It's just reality. But how we stand now, there are some gaps, even though I know there are people in the Ministry of Health and the health workers, doctors, nurses, they are very alert and they want to work hard. But from the top, I am saying to this government, we have gaps. They have to be filled. Ask for help and get everybody on board. And silly statements like people are making politics out of this is exactly what I said. It's a silly statement. We need to get prepared.
Dr. Terence Drew, medical practitioner and candidate of the St. Kitts and Nevis Labour Party. Glenn Bark for SKN Newsline.